Happy holidays and welcome to the Purdue Dairy Digest. I'm Dr. Jackie Borman. In today's episode of the Purdue Dairy Digest, we will be talking about using genomics to predict future health incidents in dairy cattle. We have been using genomics for bulls for well over a decade in the United States. Using genomic information decreases the generation interval and allows us to get reliable data from a bull well before it would have been possible if we had to wait for his daughters to finish their first lactation. Use of genomics in female dairy cattle is increasing, and in addition to providing information on production traits, genomics are also being used to evaluate health traits. Health traits are being offered with genomic selection, but there may be some questions about accuracy. Today we're going to talk about a study that was published in the Journal of Dairy Science where they took DNA samples from 3,400 dairy cows who would calve in the next 2 months. Genomic predictions for diseases, including retained placenta, metritis, ketosis, displaced abomasum, mastitis, and lameness, were estimated, and cows were assigned to groups between 1 and 4. Cows were then monitored and health events were recorded for each cow. The groups were divided into quartiles, so if you had the top 25%, 2 middle groups, and the bottom 25%, based on the genomic predictions for each disease. For each disease, when cows were ranked by their genetic prediction, there was a large and significant difference between the top and bottom 25%. For example, for retained placenta, the bottom 25% of cows had a disease incidence of 4.5%, whereas the top 25% had a disease incidence of less than 1.6%. For mastitis, the bottom 25% of cows, ranked by genomic prediction, had a disease incidence of almost 16%, and the top 25 had a disease incidence of 8.5%. That is saying that it is possible to cut mastitis rates almost in half by utilizing genomics to improve health. Lameness is another disease where we saw a large reduction in incidence between the top and bottom 25%. This shows that the genomic information is reliable for a number of diseases. When we look at a genomics report, the average is usually set to 100 for these traits. Anything that is below 100 means that a cow is more likely to develop a disease than the average, and anything above 100 means that a cow is less likely to develop a disease. These wellness traits are often looked at as a total wellness index rather than looking at individual traits. We often think of diseases, specifically metabolic diseases, as nutrition and management issues. However, this is convincing data that there is a genetic component to disease and that we can utilize genomic information to breed for healthier cows. When we think about the cost of these diseases, selecting for cows that are less likely to develop a disease will save us money in the long run.